cUTIs affect millions annually. DocLab 2.0 UTM rapid PCR syndromic panels deliver results in 48 hours versus 4 to 5 days for culture and boost cure rates by 10%. Trial NCT 06996301 proves the difference.
A PCR is a urine test that detects bacterial DNA, and it is very important for us as clinicians and urologists to use it, especially in patients presenting with polymicrobial urinary infections, because it will help us detect all the bacteria involved in this infection. Also, it is important because the results are usually delivered in less than 2 days compared to urine cultures, which can take 4 or more days. Here at Albany Urology Clinic, we were involved in a multi-center prospective clinical trial that involved 773 patients with complicated urinary tract infections, half of which were managed with rapid PCR and the other half with the regular urine culture. The results that we got were really interesting, and of course everything was already published in peer-reviewed journals. In the rapid PCR, the diagnostic time was cut in half, so the results were delivered in less than 2 days compared to the regular urine culture, which took 4 or more days. That's number one. The other thing is that it boosted the treatment success rate by 10%, and thus the rapid PCR increased that success rate from 78 to 88%. The third important thing is that also the rapid PCR can detect the genes that are responsible for bacterial resistance to certain antibiotics. This will help us a lot in our practice in picking and choosing the right antibiotic from day one, instead of having to wait for 4 or more days to choose antibiotics for the patients, and thus this would reduce the window of ineffective therapy. So the way, as I see it as a conclusion, based on this prospective trial, is that rapid PCR should become our standard of care whenever it comes to treatment of complicated urinary tract infections.
A polymicrobial infection is when more than one pathogen causes an infection. In the PCR study, PCR detected multiple pathogens in 43.5% of cases versus 32% with regular culture. PCR uncovered additional bacteria in 54% of cases where culture found nothing. Antibiotic resistance is when a bacteria does not respond to antibiotic therapy. PCR was able to detect genes that make bacteria drug resistant. Culture can miss these. In our study, culture missed antibiotic resistance in 42 cases. By finding all pathogens and resistant markers, PCR lets us choose the right antibiotic the first time, avoiding 50% of treatment failures.
I used to get UTIs all the time. I felt like I was always waiting, sometimes 5 or more days, for the culture results to come back. Meanwhile, I was stuck taking antibiotics that might not even work. Then my doctor started using PCR testing. I had results in under 48 hours. It was fast and it was accurate. She was able to change my medication right away. This time, I started feeling better sooner. I didn't have to take stronger antibiotics that I didn't need anymore, and I knew that we were treating the right infection. You know, it just gave me peace of mind. With PCR, I knew that we were finally getting it right.
I had all the symptoms, but my test results kept saying everything was fine. The culture said I was clear. So I tried to move on, but the symptoms just kept coming back. That's when my doctor suggested PCR testing. It found a second bacteria that the culture had completely missed. He adjusted my treatment, and this time the infection stayed gone. No more guessing, no more back and forth. It really felt like my doctor listened and didn't give up. PCR testing gave us the full picture, so we could finally treat what was really going on. That means a lot.
PCR testing for the chronic UTI patient has been successful on many levels. First, the patient. The patients are getting accurate results fast, so they are treated correctly, satisfied, and feeling better sooner. We discovered there are several no mores for PCR. No more for the patient taking an antibiotic that may or may not be correct for treating their infection. No more for the patient calling back saying they're feeling worse or not getting better. No more patients aren't getting a call from us 4 or 5 days later saying we need to change your antibiotic, telling them the one you're taking isn't going to work for your infection. No more patients having to make a repeated trip back to the pharmacy. We found all of these no mores the patient no longer goes through with PCR versus the former culture. This is time savings for our staff. PCR is a benefit to our operators. frees up phone lines. Patients calling back to the office saying they're feeling worse or not better. Asking to be seen again. PCR is a benefit for our nurses, frees up nursing time from phone calls. Not taking the continuous calls from the patient or having to call the patient back because their med has to be changed. PCR is a benefit for our physicians, frees them from going back into the chart, changing meds to get them on the correct one. PCR is a benefit for our lab staff. It's free to do other things and not work cultures 7 days a week. Best of all, frees up an ER bed from a potential septic patient that did not get on the correct med 3 or 4 days ago. PCR for the chronic or high-risk UTI patient has proven accurate, faster results, along with improved patient outcomes and satisfaction.